This is Prateek Gupta. I'm a vascular surgeon based in Memphis, Tennessee. We started a company late 2018, beginning 19. So we have been in existence around 7-ish years. We have 13 offices in the tri-state area of Arkansas, Tennessee, and Mississippi, and 2 ambulatory surgery centers. We are 4 vascular surgeons in our practice, along with multiple nurse practitioners. We are the biggest vascular surgery group in the Memphis area for sure, and probably in a 150-mile radius. We focus on all aspects of vascular care. Basically, that's blood vessels outside the heart and brain, including arteries, veins, and pretty much anything to do with any blood vessel. So for a medical office, especially a subspecialty office, it's very important we don't miss phone calls. A medical practice like ours relies on referrals. So, if somebody wants to send you a patient and you don't pick up the phone, it's a bad problem. They will call one of our competitors and the patient, referral to us is lost. So it's very important to pick up phone calls. So we had, an ever increasing size of the department. However, we were continued to miss a lot of calls. So that was the first aspect. And then the second, it's hard to find well-trained people who follow the script, who are pleasant to the patients calling or to, referring doctor offices calling, and create an overall good impression. So we had struggled with both of those. We would miss a fair number of calls. And then we also had a lot of complaints that, the people were not nice or pleasant to talk to. And that's the face of the practice. So if the face of the practice doesn't convey a good first impression, it affects the growth of the practice. I think the word of mouth was extremely strong. We're talking about VP of Sedgwick, and you guys were doing it for Sedgwick. That's a pretty big recommendation. A big company like that, you're doing so well. We are a startup, you'd be fine. But besides that, I think the initial conversations we had, you were very receptive to our needs. You wanted to understand, what we wanted and worked with us. We didn't look at a whole lot of companies, to be honest. We looked at, a couple of them besides you, but did not feel the vibe with anybody else, honestly.
Honestly, I think we don't have to really worry about the call-ins. Like if somebody's out sick, we don't have to worry about filling the position. So that helped a lot because most of the time we don't have any extra employees to pull. And I think also when we switched over to Zoom, the direct messaging and stuff made it a lot easier because we could quick response instead of like hopping on a call or looking at our phone for text messages or emails, and it just comes straight and pops up to us and we answer it and they continue on. So that really helped out a lot.
It really helped us not having to think about the staffing component. We knew that regardless of what day it was, what time it was, if an emergency popped up, the rest of the team was there to take care of it. And we didn't have to pull resources from somewhere else to patch the call center, which is just very reassuring to us. We didn't have to worry about manpower or anything like that. Additionally, I would throw in too, the team has done so well over time in recognizing key issues that our patients experience. And over time, they've grown in confidence in how to address those issues without having to consult Shelby or I. And so it's alleviated us in some regards where they're able to handle kind of first tier and second tier problems before those get escalated to us. So frees us up a little bit more during the day to focus on true operational issues rather than having to hop on the phone and assist patients for things that are considered minor.
You only have so much time and so much energy to make key and critical business decisions. So forget the patient outcomes. You have to do that anyway, but you have only so much time as your business is growing at a, hyper scaling to devote time and energy to business. There are certain things which are more critical you want to put more attention to, and certain things you don't want to deal with. And fortunately, this has become one of those things that we don't have to deal with at all because it just runs perfectly. And being the face of the practice, this is so important. Like if your call center messes up, it'll impact the growth of the practice. So we have been growing by 20 to 30% year on year in terms of patient growth. And the front-facing aspect of the practice is really important for that. And that's one thing we don't worry about at all. We are worried about, we're planning new offices, we're planning surgery centers, which have opened in the last year, hiring other surgeons. I mean, there are a lot of, something going on every day from the business side besides patient outcomes. But I don't think we think about the call center, at least at the executive level. We haven't thought about it for a whole year. I mean, it runs perfectly. I personally don't know any other service. I mean, there are a couple of people I know who are using, random mom and pop shops outside. Um, it's not seamless. I mean, this is seamless. So that would be my recommendation to give your guys a try.